Okay, next question. Telling of wound suggests direction of the injury, weapon used, type of wound, and surface of wound. Telling of wound means if you look at a wound, like it appears like this. Okay, so typical wound looks like wound made by knife blades, looks like this. So it suggests direction of the injury. Direction of injury. Now you see, in fact, the drawing that I made, the first portion is more wider and deeper, and the this tail portion, this is the head portion, and this the tail portion, it is more narrower and more shallower. Okay, so telling of wound is the characteristics, one of the characteristic of the incised wound that indicates the direction in which the cut was made. Now how? Incised wounds are deeper at the beginning, like this. This is deeper at the beginning. It looks like deeper at the beginning. Okay, and next, or you see the real wound, it looks like deeper at the beginning. This is beginning. As more pressure is exerted at this point, it is called as head of the wound. This portion is head of the wound. Head of the wound. Now towards the end of the cut, the wound becomes increasingly shallow. This portion, even you cannot clearly demarcate that. There is no, you see, there is no demarcation, clear demarcation where the wound is ending. Like it started ending from this portion to this portion, shallow, in a shallow, very shallow depth. So till finally, as the knife leaves the tissue, the skin alone is cut. Only skin is cut. Here only skin is cut. Only skin. Okay, so it has not gone deeper. So this is called tailing of wound. So it shows the direction has been made from this side to this side. Okay, from more medial to towards thumb. Okay, towards thumb. So tailing of wound suggests direction of injury. Now the tentative cuts are seen in tentative cuts or hesitation marks, we call it hesitation cut, are seen in suicide. Okay, so the tentative cuts or hesitation marks are multiple small superficial cuts seen in the cases where there is trial of suicide. Most common site is for tentative cut is forearm, where a person who commits suicides, most probably he or she thinks to cut his or her forearm and commit the suicide. Okay, not leg or not the neck. And while cutting the forearm, he or she, the concerned person, will hesitate. Will feel, you know, he himself will become scared. He will hesitate. Still he will hesitate whether I will die or not, or like he cannot cut himself, because when he will touch the knife, when he will touch the knife on the skin, it will feel pain, and due to pain he himself cannot cut himself. He cannot cut himself. That's the point. That's why he will try first. He will give a small multiple cut. Okay, so this is tentative cuts or hesitation cuts. So if there is tentative cuts, the whole situation will go more towards suicide case, not homicide, or obviously not accident. Okay, next, hydrostatic test is not required in monster child, mummified child, non-viable child, all of the above. So in neither of these, actually, hydrostatic test is done. It is because hydrostatic test is a test that is used to differentiate between respired and non-respired lungs, and it is not necessary, it is not done if fetus is dead with signs of maceration or mummifications. Number one. Number two, if fetus born before 180 days of gestation, that is non-viable. Number three, the stomach contains milk, not done, not necessary. Number four, umbilical cord separated and scar formation at umbilicus. Number five, when fetus has gross congenital anomalies, that is monster child incompatible with life, for example, anencephaly or any other congenital malformations, that's called monster child. Okay, monster child. Okay, next, transverse tear in intima of carotid arteries may be seen in partial hanging, judicial, Banzdola, garroting. Transverse tear in intima of carotid artery is seen in judicial hanging. Very important. Transverse tear in intima of carotid arteries is seen in judicial hanging. So now Amosert sign. Amosert sign is typically a transverse laceration of the intimal layer of carotid artery described in cases of hanging, and subtotal laceration of the carotid artery is not strictly specific for hanging and can also be caused by blunt neck trauma, extreme overstretching, or whiplash. Whiplash injury we have studied about. So important thing is transverse tear in intima of carotid artery is seen in judicial hanging. Adduction fracture of hyoid bone may be seen in ligature strangulation, manual strangulation, hanging, Banzdola. So inward compression of fractures of hyoid bone. Inward compression of fractures of hyoid bone are seen in case of throttling, where the main force is an inward compression acting on hyoid bone. Okay. So adduction fracture of hyoid bone may be seen in manual strangulation. All are strangulation except barking, throttling, mugging, garroting. The answer will be barking. So we revise what are the types of strangulation and all. So strangulation basically it's a form of asphyxia. And by which occurs by constriction of neck due to ligation. By ligation, but no body suspension occurs in it. There is no body suspension like in hanging. Here, this occurs in hanging, right? This occurs in hanging. But in strangulation, constriction of neck is done by other means, by other objects, including hand, cloth, anything. Constriction of neck is done by other objects externally used. Like types you see the types of strangulation. Banzdola, bamboo stick is used at the back and the front of the neck, just like this. Banzdola. This is a bamboo stick. This is two bamboo stick neck. Okay, and it is used. These two bamboo sticks are used to compress the neck. So constriction of neck leading to asphyxia, but no body suspension, just like in hanging. No body suspension occurs. Next is garroting. Garroting is attacked from behind with a rope over the neck. So this is by Banzdola by bamboo stick. Banzdola by bamboo stick. Garroting by rope. Garroting with the same thing. Obviously, you cannot expect two rope will not work in this way. If this is neck, rope is also tied like this. Knot is like this. And it will be compressed. It will be extended. This rope will be extended, and naturally what will happen? The rope will be tied tied tightly around the neck and thus constricting it. Okay, so that is garroting. That is garroting. Next is mugging. Mugging is holding the neck of the victim in the bend of the elbow. So this is neck, again same thing, is bend of the elbow. Okay, bend of the elbow. So that is mugging. So mugging, what is used? The external object is bend of the elbow, or elbow simply. Elbow or hand by bending. So these are the three types of strangulation, main strangulations. Another thing is there, that is suffocations. Suffocation. So the question was, all are strangulation, but which one of this is not strangulation? That is barking. Then what barking is? Barking is suffocation. Suffocation and strangulation, main difference is that there is constriction of neck. Constriction of neck, thus asphyxia is produced, where in suffocation the victim is deprived of oxygen by obstruction of the air entrance into respiratory tract. Now by what means? That differs, that varies. If it is by smothering, like depriving of oxygen by closing the nostril, number one, that is barking. If forcing cloth into mouth, that is gagging. Obstruction of air passage between pharynx and tracheal bifurcation, then that is choking. That's why we call it food chokes. Due to food choking, the person died, or choking, or any foreign object has got introduced into the between the pharynx and tracheal bifurcation, leading to choking. Okay, that's why we call it choking, but we don't call it gagging or barking, because barking is closing the nostril. What will be the, you see the definition of types of definition of suffocation. In suffocation, the victim is deprived of oxygen by obstruction of air's passage into respiratory tract by several means, by any means. That any means, that means this method varies. If the method is closing the nostril, barking, forcing cloth into the mouth, gagging, and obstruction between pharynx and tracheal bifurcation, choking. Now when hands are used to squeeze or compress the neck, it is compress the neck. So this is barking actually. Okay, this is another form of barking, like hands are used to squeeze and compress the neck. So this is kind of, strangulation. Sorry, this is kind of strangulation. Okay, so in strangulation, what happens when hands are used to squeeze or compress the neck? That is general form of strangulation. It is always homicidal. Another thing is very important between difference between strangulation and differentiating point between strangulation and suffocation is that strangulation is always homicidal. A person cannot do on himself. It is always homicidal, while suffocation can be accidental. Because you see, choking can be accidental, food choking, foreign object choking. Okay, and forcing cloth into the mouth usually do not becomes by accident, although it can be. Okay, choking is quite accidental. quite accidentally happens. Another thing, in case of strangulation, the autopsy findings that we get are signs of asphyxia are seen, that is bruising of the neck. Another thing, in strangulation, as neck constriction is done, there will be bruising present. Bruising of neck. Bruising of neck is present. Because the force that is applied for constriction of the neck is quite large. Okay, quite large. So the person who is constricting the neck to for homicide, for killing, murdering, or anything, killing that the victim, he will impart a lot of pressure, lot of force, and that's why there will be bruising of the neck, of the skin of the neck. Occurs due to assailant finger grasping the neck, usually circular, dark red and purple in color, and 1 to 2 centimeter in size. If the fingers slide over the skin, then there will be elongated marks. Not only the finger tips, breadth of the finger. The marks will not only be spanning the breadth of the finger breadth, it will be more like this, more. Okay, because if it slides over the skin. So these are small points. It is mostly circular, dark red or purple in color. And bruising of the neck is very important point in case of autopsy finding, in case of strangulation. So next question, which one of the following shows signs of suicide? Red congested face, saliva dribbling to the opposite side of the knot, the position of the knot at the angle of mandible, and ligature mark continuous around the neck. So signs of suicide. And the answer is saliva dribbling to the opposite side of the knot. Okay, so first of all, red congested face means is strangulation. It supports strangulation, and strangulation means homicidal. Strangulation means homicidal. So it's not suicide, right? It's not suicide. So here they told signs of suicide. Then if the position of the knot at the angle of mandible. So if the knot is at the angle of mandible, knot is at the angle of the mandible, then also it is mostly observed in homicidal case, not suicidal. And ligature mark continuous around the neck. Ligature mark continuous around the neck. That is also sign of homicide. But saliva dribbling to the opposite side of the knot, this shows it is not strangulation and hanging. This is not strangulation. The saliva dribbling occurs only in hanging, and very rare in strangulation. Most probably in strangulation there will be no dribbling of saliva to the opposite side of the knot. Okay, and other features, you see the position of the knot and the angle of mandible, ligature mark continuous around the neck. That means what? This means maybe this happened, like this garroting may occur. So obviously that is strangulation and homicidal. So ligature mark is continuous around the neck. So this is more appropriate answer for this question. Which one of the following shows signs of suicide? Saliva dribbling to the opposite side of the knot. Saliva will rarely dribble in case of strangulation. And the red congested face and marked petechia occurs in strangulation. no petechiae. In hanging, there will be no petechiae. Bleeding from mouth, ears, and nose. Rather, bleeding from mouth, ears, and nose occurs in strangulation. Okay. So, next question. Yellow color of the bruise is seen due to biliverdin first day, bilirubin on 9th day, bilirubin on 4th day, biliverdin on 14th day. Okay. So the answer will be bilirubin on 9th day. Now, when bruises heal, during the healing process of bruise, extravasated blood gradually removes. Extravasated blood. Actually, when bruises occurs, there will be rupture of smaller capillaries and accumulation of smaller capillaries will be ruptured and accumulation of RBC around the surrounding the site or all over the site where bruise has been taken place. Okay. Now this extravasated blood gradually starts removing. This change of due to this there will be change of color at the periphery and extends inwards to the center. Now, first of all, when these bruises occur and when there will be this blood vessels rupture occur, these capillary ruptures occur, ruptures, then there will be extravasated blood, oxyhemoglobin will be there, the reddish blood. Okay, oxyhemoglobin. So color will be red. Then this blood, as I have told you, is not getting refreshed, is not getting reoxygenation. So that's why oxygen will get finished and gradually CO2 will accumulate and it will become blue. And then on day 5th, it will become brown or violet hemosiderin due to presence of hemosiderin. So RBC will be start breaking down. And then biliverdin will come into existence between day 5 and day 7. And that is green. And in more than 7 days, there will be bilirubin, which is yellowish. So yellow color of the bruise is seen due to obviously bilirubin. Now bilirubin on 2 options are there. Obviously biliverdin is not, it's not possible, right? Because biliverdin is green. So when yellow it is, they are telling yellow, that means it is bilirubin. It is bilirubin. Now the question is whether 9th day or 4th day. So bilirubin comes at the last, more than 7th day. So 9th day will be the answer. Okay. Okay, next question. Most common cause of death in drowning is cardiac arrest. Now, drowning is mostly accidental, occurring from suffocation resulting from aspiration of water. So it is kind of suffocation due to, and it occurs due to aspiration of water aspiration or other substance or fluid aspiration. It can be of 2 types. One is wet drowning, another is dry drowning. So what is wet drowning and what is dry drowning? In wet drowning, water is found in the lungs, while in dry drowning, the death occurs due to reflex laryngospasm and not essentially water. Very important. Wet drowning, actually it occurs due to water in respiratory tract leading to suffocation. Water in respiratory tract, water enters in respiratory tract and suffocation occurs. While in dry drowning, death occurs and obviously death. Okay, and in dry drowning, Death occurs due to reflex laryngospasm. Reflex laryngospasm, for that actually suffocation occurs. Suffocation occurs. But water doesn't enter. Water is not blocking the pathway. Rather, as there is laryngospasm, what happens is that larynx becomes blocked and air cannot go into the respiratory tract, leading to death. But not essentially water is going and blocking the respiratory tract. And that is why we call it dry drowning. No water is found, and as a result of which, no water is found in lungs. Cause of death is metabolic acidosis, pneumonia, electrolyte imbalance. This is dry drowning. But in wet drowning, cardiac arrest occurs actually. Cardiac arrest. Now, another thing is important is freshwater drowning or seawater drowning. In freshwater drowning, it is characterized by hemodilution. That means blood will be diluted. There will be hyperkalemia, which leads to ventricular fibrillation. But in seawater drowning, it is characterized by hemoconcentration in the body because it is saline water and very much saline water. So it is characterized by hemoconcentration in the body, hypernatremia, and ultimately death will occur due to bradycardia. So drowning, another thing is drowning in extreme cold water is called hydrocution. It leads to death due to vasovagal shock. Due to vasovagal shock. Due to cold water, extreme cold water. Okay, so this is about drowning. Next, juvenile is a girl who has not attained the age of 12, 14, 16, and 18. Answer will be 18. According to the Juvenile Justice Act 2000, Care and Protection of the Children. Care and Protection of the Children, Juvenile Justice Act 2000. Juvenile or boys means person or boy or girl, whatever, who has not completed the 18th year of age. Very simple, fact-based question, but important. Next question, intraocular tension is nil after death in about 1 hour, 2 hour, 3 hour, 3 hours, and 4 hours. So intraocular tension is nil. Nil after death. So during life, IOT or intraocular tension varies between so during life, IOT varies between 14 to 25 GM. Soon after death, it is less than 12. And within half an hour, it is less than 3. So it becomes nil at the end of 2 hours. Okay. So it nil at the end of 2 hours. And the answer will be 2 hours. So just remember, you don't no need to remember all this each and every hour. Just it becomes 0 at end of 2 hours. That is most important. Bacteria helpful or involved contributes in adipose hair formation: Staphylococcus, E. coli, Proteus, B. Proteus, and Clostridium welchi. So obviously welchi. The process of adipose hair formation starts under the influence of intrinsic lipases. Intrinsic lipases and is continued bacterial enzymes of Clostridia group, mainly perfringes. As the bacteria produces lecithinase, which facilitates hydrolysis and hydrogenation. Okay, so the bacteria that is involved in adipose hair formation is Clostridium welchi. First external sign of putrefaction is marbling of skin, distension of skin, protrusion of tongue, and greenish discoloration of abdomen. So the answer will be first external sign of putrefaction is marbling of skin, distension of skin, protrusion of tongue, and greenish discoloration of abdomen. And the answer is greenish discoloration of abdomen. The first external sign of putrefaction in a body lying in air is usually greenish discoloration of the skin over the region of cecum, which lies fairly superficial and where the contents of the bowel are more fluid and full of bacteria. Okay, the first external sign of putrefaction lying in air, that is also important. Lying in air is greenish discoloration. Okay. Okay, next question: putrefaction of a dead body buried in dry soil as compared to air is same rate. Putrefaction which is buried in dry soil as compared to air is same rate, quicker, slower, variable? Is more slower, obviously. Putrefaction is delayed if the body is buried in dry, sandy soil or in a grave deeper than 2 meters, and when the body is covered and placed in a coffin because of exclusion of water, air, and action of insects and animals. Okay, so because you know there is a involvement of bacteria. The place where there is fluid, there is and bacteria and bacterial exposure, those places putrefaction will be more easier. But if it is placed in dry soil, if it is placed in dry soil, sandy soil, then coffin, grave deeper than 2 centimeter, deeper than 2 centimeter, 2 meter, 2 meter. So in all this case, it will be delayed. It will be delayed. Okay, these are the signs of death. Immediate signs of death is insensibility and loss of EEG rhythms, then cessation of circulation of ECG rhythms, means heart, and cessation of respiration, then cadaveric spasm occurs. This we call somatic death. And early changes after death are cooling, skin changes, eye changes, blood changes, including hypostasis, fibrinolysis, postmortem bleeding, chemical changes in the body fluid, and muscular changes like rigor mortis. We call it cellular death. Early reliable sign. In this case, we don't call it, it's not reliable, okay? It's just somatic death. And late changes are like putrefaction if it is left in the open, if the dead body is left open anyhow. Then putrefaction in air, water, and earth. Quickest in air, quickest. Then water and earth. Next, adipose hair formation, mummification, larval infestation, and already not only death but also decomposed and decayed. Okay, these are the signs of death. In case of cold water drowning, death is due to vagal stimulation, vagal inhibition, hypervolemia, ventricular fibrillation. And the answer will be vagal inhibition. Cause of death in drowning is, especially the cold water drowning, is vagal inhibition. So we need to revise, like asphyxia, cause of death in seawater drowning. Inhalation of fluid causes obstruction to air passages leading to respiratory and circulatory failure due to anoxia. Ventricular fibrillation, death in freshwater drowning. Death in freshwater drowning. Death may occur in 3 to 5 minutes from the combination of anoxia and electrolyte imbalance, leading to ventricular tachycardia and fibrillation. Now this is ventricular fibrillation. And next, vagal inhibition, most common cause of death in icy or cold water, drunkenness, high motions or excitements. Vagal inhibition occurs. Like, respiration is getting arrested. It seems that respiration getting arrested in case of vagal inhibition, it occurs. Icy cold water, then high emotions when people cry a lot, or excitement also. Now exhaustion and injuries, cause of death in drowning. So first is asphyxia. So why person died by drowning? There are some causes. There are different causes, different reasons why a person can die after drowning. Number one is asphyxia, because very simple, that is fluid will get inhaled. The person will inhale the fluid, leading to obstruction of the air passages, leading to respiratory and circulatory failure due to anoxia. Anoxia means absence of oxygen. Next, ventricular fibrillation, death in freshwater drowning. Now asphyxia occurs in seawater drowning. Very important, asphyxia occurs in seawater drowning, while ventricular fibrillation occurs in freshwater drowning. Death may occur in 3 to 5 minutes. And from the combination of anoxia, that is absence of oxygen, plus electrolyte imbalance, leading to ventricular tachycardia and ventricular fibrillation. Ventricular tachycardia and fibrillation. Next, vagal inhibition, like drunkenness, high emotions, cold water. Then exhaustion. For example, if somebody in cold water or a big water body like sea or ocean, people have to, if somebody get into the water anyhow accidentally from the boat accident or anything, how much time they can be in water for a long time? They cannot be they cannot be floating in the water. Even if he or she knows swimming, he cannot float in the water, swim in the water continuously for a long time. He will get exhausted in those cases, especially. And after that, after some time, we also, while walking or running, we get exhausted and we sit down. Here, there is no way of sitting down and taking rest. If you live, you will just drown. Okay, so exhaustion occurs, and ultimately the person give up and die. Next, injury. Injury especially occurs in shallow water bodies from rocks beneath the water bed. Okay, injuries. So anyway, death in fresh water takes almost 4 to 5 minutes, while in salt water takes 8 to 10 minutes. This is also important. In fresh water, it's less time. Most common feature indicative of antemortem drowning: washer-woman feet, pugilistic attitude, clenched fist, cyanosis. Antemortem drowning. Antemortem drowning means the person drowned first, then died. First drowned, and then died. Okay, in this case. So the answer is clenched fist. So the answer is clenched fist. So the see first the antemortem drowning. What are the signs of antemortem drowning? So when the person, you have to understand that when the person drowned into the water, he was alive. So if a alive person drowns in the water, what he will do? First of all, he will try to try tightly hold something. Like if this is a pond and if this person is dying, it's a drowning. Yeah, then he will try to hold the weeds and small herbs and shrubs surrounding the pond. Okay, so we get weeds and grass, and when drowned, he will try to catch this and that, because the water will make him unstable, in an unstable position, and will move continuously. That's why he will feel unstable, cannot be in a same position, and that's why he tries to become stable. He tries to make his position stable by tightly clenching the hand, tightly holding something. A very definitive sign, very definite sign. It shows this is antemortem drowning. Next, find copious white leathery froth from mouth, nose, and ear passages, which increases on chest pressure. Okay. Next, very definite this. In internally, we get water in the stomach, because the person will drink a lot of water, and the whole stomach and intestine will be full of water. Diatoms will enter into the brain and bone marrow of long bones through digestive system, obviously. So water in the stomach and intestine and middle ear. Next, non-specific sign: cutis anserinine or goose skin. Cutis anserinine or goose skin is non-specific sign. Washerman woman hand and feet. Next is pult of hemorrhage, emphysema, accusum. Pult of hemorrhage and emphysema, accusum. These are non-specific signs, and these are non-specific signs of antemortem drowning. But you need to know this cutis anserinine and goose skin, washerwoman hand and feet, pult of hemorrhage, and emphysema. Okay, next is question from pult of hemorrhage is seen in, obviously, we call it drowning. We already started drowning. Pult of hemorrhage is what? It is subpleural petechial hemorrhage. Subpleural petechial hemorrhage, shiny pale pink or bluish red, and maybe minute or 3 to 5 centimeter in diameter in case of drowning. During drowning, there is more powerful inspiratory force which causes air entry into the lungs with water and foam, which makes the lung heavy and increase pressure inside, leading to forced expiration, causing rupture of the alveolar walls, may be present subpleurally, referred to as pult of hemorrhage. So what is happening? During drowning, there is powerful inspiratory effort which causes air entry into the lungs. Because this happens because during drowning, the concerned person cannot get air. Instead, he gets water. But water will not do the respiration, right? So he tries to get air, and while getting that air, the person inspire with full effort and more powerfully. And due to that, what happens? More water goes into the lung, goes into the respiratory tract, and there will be, and the lungs becomes heavy, and pressure increases. Pressure increases inside the lung, inside the respiratory tract, and it when the lungs found and when the body founds, oh my God, the water in the respiratory tract, respiratory respiratory tract is full of water. We have to expire it, expel it. Then forced expiration occurs. Then forced expiration occurs, and which causes alveolar rupture. Alveolar walls rupture that may be present subpleurally, and when this rupture occurs, there will be hemorrhage. There will be subpleural petechial hemorrhage, appearing as shiny pale pink or bluish red, 3 to 5 centimeter in diameter. That is called pult of hemorrhage. Okay, it is most commonly occurring in the lower lobes of the lungs. Site, main site is lower lobe of the lungs. So other important findings of drownings are emphysema accusum, edema accusum, diatom, washerwoman and feet, and cutis anserina or goose skin. Next, pugilistic attitude is seen in drowning, burns, lightning, and hanging. So the answer will be burns. This is a typical pugilistic attitude. Attitude means the way of what to say, the pose of the body, posture of the body, typical posture of the body. So pugilistic attitude is an extremely typical postmortem body posture that is similar to kneeling position, but it is involuntary. The whole image is not shown actually. Not only the hands are like this, hands are in this position, but also the legs are like this. Legs are also like this. Okay, so the condition occurs several hours after death. Several, when it occurs, very important. Even MCQs come from these points, this type of facts, from this type of facts. Several hours after death. When pugilistic attitude occurs, it occurs several hours after death, and it's caused by coagulation. It is caused by coagulation of muscle protein, because due to burning, coagulation occurs. Because muscle, in muscle there are proteins. So when protein is burnt, what happens? Coagulation occurs. And when the body is exposed to extremely high temperature. So pugilistic attitude only seen in case of burns, and also known as boxing or fencing attitude. It is due to coagulation of proteins and other than those affected by rigor mortis, and seen both in antemortem as well as postmortem burns. So burn before death and burns after death. In that also pugilistic attitude is present. Very important point for FMG. Very important point. So it cannot be used for differentiating antemortem and postmortem burns. Cannot be, because in both the cases pugilistic attitude is present. Okay. Which of the following is seen in antemortem burn? Decreased alkaline phosphatase, chlorine increased, Chlorine increased and albumin decreased in vesicles. Presence of carbonaceous deposits in respiratory tract. Dull base of blister. So presence of carbonaceous deposits in respiratory tract. So antemortem burn and postmortem burn, differentiating points. Very important for FMG. Very important for FMG. First of all, line of redness present around the injured burn area, but in postmortem it's not. You need to understand one thing, that antemortem burn, while burning, while the burning was occurring, the person was alive, and due to the fact that the person was burned, he or she died. That is why you can get more live, in a very common language, you can get very many lively features in antemortem burning. While in postmortem burning, when the burning is occurring, it's not a live person, it's already a dead person. So you will not get such lively features, and most of the things are never absent. Most of the features are absent, not seen, like this. Okay, like line of redness present around the injured burn area, while in postmortem burn, there is no line of redness. In case of vesicles, there will be vesicles. In case of vesicles in antemortem burning, contains serous fluids with high proportion of albumin and chloride. So albumin and chloride, this two. And in case of postmortem burning, contains air mostly. Mostly it's air. If the fluid present, if fluid present, it comprises of very little albumin and no chlorides. This is vesicle. Next is base of blister. Red antemortem burning, there will be the base of the blister will be red and inflamed, while in postmortem it is dull, dry, hard, and yellow. And you see this red and inflamed means overall we can say inflamed post inflammatory features of inflammation can be seen. Now, do you think features of inflammation can be seen on dead body? Obviously not. The body is at that time the body is already dead. So in postmortem burning, there is no redness or inflammatory features. In case of antemortem, there is inflammation. Now that's the thing that I just told. Inflammatory evidence, inflammatory edema occurs, repair processes, leukocyte infiltration occurs, but obviously in a dead body there will be no inflammatory edema. There will be no leukocyte infiltration. Inflammatory processes, obviously it is very basic fundamental thing that inflammatory processes will only be present in a living body, not in a dead body, right? So in postmortem burn, there will be no such changes. Okay, presence of carbonaceous deposit or soot in the respiratory tract will be present in case of antemortem burn, because it indicates death from smoke or suffocations following antemortem burn. That means when the body was burning, there were when the human body is full of carbon, and when the body burns, and when a body burns up very black, carbon monoxide and carbon dioxide later on, carbon dioxide, carbon monoxide, sulfur dioxide all comes out as a smoke. And while the body was burning, still the body was alive, and that's why the body smelled or taken the smoke, and that is why that carbonaceous deposit or carbonaceous materials get into the nostril. get into the nostril to the respiratory tract. But in case of post-mortem burning, obviously a dead body cannot smell. The dead body will not smell. That's why there will be no presence. There will be there will be no presence of such deposits or soot in the respiratory tract. Now, presence of carboxyhemoglobin present, and in postmortem it is absent. And enzymatic activity will obviously present in antemortem burning. At 2 hours, leucine aminopeptidase. At 3 hours, acid phosphatase. At 4 hours, alkaline phosphatase. So this will be increasing. Okay, this will increase, and immediate cathepsin will increase. And at 2 hours of the burning, leucine aminopeptidase. At 3 hours of burning, acid phosphatase, and at 4 hours of burning, alkaline phosphatase. Alkaline phosphatase. But in case of postmortem burning, obviously, all these enzymatic activities will be absent. Will be absent, right? Okay. Next question. A posthumous child is stillborn, born after father's death, born after mother's death, fictitious child claimed by a woman as her own. The answer is after father's death. Born after father's death. So posthumous, the definition of posthumous child is the child who has born after father's death and the mother being conceived by the said father, by his father only. That is posthumous child. Suppose you need to know all these terms. Supposititious child is fictitious child claimed by a woman as her own. A woman may pretend pregnancy, deliver, and later produce a living child as her own, or substitute a living male child for a dead child, or for a living female child born for. That is supposititious child. And spurious or phantom child, that is pseudocyesis, is usually seen in women nearing menopause, or younger women with an intense desire for children. This occurs phantom. Phantom, the word phantom means only pretension, is false claim. Okay, so it occurs in this phenomena occurs in during menopause, or sometimes you can see those girl child, or not child, teenagers, or just after 19, 20 years, 21 years, they want to get a children or like that. So spurious or phantom child, they seems to have that they pretend that they're getting a child, or they have already got child. Okay, that is phantom child. And supposititious child and posthumous child is very important term. Next, Florence test is used for blood, semen, urine, and albumin. It's used for semen. Now, what are the tests available? Let's see. First of all, test for detections of seminal stain, acid phosphatase, Barbados, creatine phosphokinase, Florence. Most specific test for seminal stain is isoenzyme LDH assay. For dry seminal stain, UV rays are used. Blood benzidine test, blood base preliminary, as it detects blood present in the dilution of 1 inch. Present in dilution. Okay, base preliminary test for blood benzidine test is best preliminary test for detecting blood, whether it is blood or not. And the resultant color produces deep blue. Not used because it is potentially carcinogen nowadays. And Castle-Meyer phenolphthalein test, color produced is pink purple. Microchemical test based on RBC content of the blood. And Takayama test, hemoglobin converted to hemochromogen crystal, hemochromogen crystal, salmon pink, feathery hemochromogen crystals are obtained here. Tickman's hemine test, hemine crystal test. In this, what happens? Hemoglobin converted into hemine or hematine crystals. Next is spectroscopic test is more specific and confirmatory method for blood stain test. Spectroscopic test. Spectroscopic test. Spectroscopic test. More specific and confirmatory test for blood stain test. So more specific for blood stain is spectroscopic test. Very important point. It comes in the MCQ as well. Thin layer chromatography and electrophoresis test to distinguish human versus blood animal is precipitin test. So most important things like fluorescence, creatine phosphokinase, Barbadios, acid phosphatase also. Barbadios test detect what? Spermine. And for old seminal stain, creatine phosphokinase. So it can happen, it can come like this. For old seminal stain, what test can be used? Acid phosphatase, Barbadios, creatine phosphokinase, fluorescence. Now the point is, 4 of the options are used for detection of seminal stain, but only one is there. Only one is there which can be used for detecting seminal stain. Old seminal stain, sorry, old seminal stain. Okay, otherwise Barbadios test not used for old seminal stain. Acid phosphatase to detect cases, and fluorescence for choline crystal of cement shows fluorescence when examined anyway. It's different. Okay, so and test for distinguishing human and animal blood. This is also very important. That is precipitin test. Okay, all are true about MTP except only qualified medical practitioner is allowed. MTP is medical termination of pregnancy. Only qualified medical practitioner is allowed to perform it. Medical assistant can perform in an absence of gynecologist. Husband's consent is not required, can be done up to 20th week. So the answer will be medical assistant can perform, all are true except medical assistant can perform in absence of gynecologist. Okay, another thing is that husband consent is not required, that is true. Only qualified medical practitioner is allowed to perform it, that is also true, and very important point for the doctors. Not every doctor can do it. Can be done up to 20 weeks. Now one bill has been passed, not yet confirmed. One bill has been passed. The second stage of the bill has been passed. Up to these 20 weeks will be extended to 24th weeks. After the finalization, it will be maybe it will be passed. Actually, already it has passed in several stages, and after that, very sooner, it will be made into a law. So this is one of the update information has to be updated. 24th weeks it will become, but still it has not become 24th week still at this point. Okay, so if up to June, up to the month of June, means when the exam, FMG exam will happen, if up to that this law doesn't pass, this bill doesn't become a law, then you need to choose 20 weeks. Otherwise, if it becomes a law, then you need to choose 24 weeks. So it depends. Otherwise, it will be a wrong answer. Okay, so when indications of MTP, failure of contraceptives in a married woman can go for MTP. Child born with serious physical and mental abnormalities, the mother can go for MTP. If continuation of pregnancy endangers life in any way, can avail MTP. And if pregnancy is outcome of a rape, obviously it can be the mother can go for MTP, but otherwise abortion is not preferred. Okay. Another important points about MTP Act 1971. MTP Act 1971, even the year is important. MTP Act 1971. So anyway, only qualified medical registered practitioners can perform it. CMOH means Chief Medical Officer of District is empowered to certify that a doctor can perform it. A medical practitioner should have performed 25 cases to get certification from CMOH. The medical practitioner should have performed from CMO, Chief Medical Officer of District. A medical practitioner should have performed 25 cases of MTPs in a recognized hospital. Okay, then the operation should be performed either in a government hospital or a recognized place, means government accredited MTP centers are there in those only. Otherwise, just you cannot open a clinic and go for MTP. No, that's not legal in our country. Next point, non-government institutions authorized by Chief Medical Officer can also perform MTP. Authorized by Chief Medical Officer, as I told, authorized by government means on behalf of the government, Chief Medical Officer. Consent of husband not required, however, written consent of the woman or her guardian if she is minor or mentally ill, then only. Otherwise, consent of the husband is not required to go for MTP. Abortion cannot be performed at her husband's request if the woman is not willing. So woman's interest or the mother's interest is the biggest one. If husband is interested but mother is not, then no MTP. If husband is not interested or do not know about it even, but mother is willing, then yes, MTP. Okay, so mother's will is most important here, and no age is required. And if the woman was raped, it's not necessary to take police complaint even. Okay, professional secrecy should be maintained by the doctors and the institution where it will be done. And if the duration of the pregnancy is 12 weeks, then opinion of single doctor is required. And if it is within 12 weeks, actually, if it is between 12 to 20 weeks, 2 doctors should consent that there is an indication for MTP. Otherwise, you cannot go for MTP. Termination can only be performed by termination can be performed by any of the doctor and permitted up to 20th week. Preferably CMO, Chief Medical Officer certified doctors can perform MTP, but if certified doctor is unavailable, then another doctor can perform. Okay, but it has to be documented very neat way. And single doctor opinion is fine and well and fine up to 12 weeks pregnancy. But between 12 and 20, 2 doctors should prescribe, should give consent, should give consent. There is an indication. Okay, this is about MTP. In case of typical hanging, position of knot is at occiput, angle of mandible below the chin, side of the neck. So, in typical hanging, position of knot is at occiput. This is side of the neck. Okay, in occiput. Occiput means backward. So typical hanging, atypical hanging, and complete hanging. See, the whole body is in suspension. Is hanging, and this is partial hanging. It is supported by the legs, lower limbs. So typical hanging, the knot of the ligature should be at the nape of the neck, on the back. That is occiput. V-shaped above the thyroid cartilage, and suicidal hanging. This is example of suicidal hanging. Typical. But in atypical, at any site other than the nape of neck, atypical. Most common site is near the angle of mandible. No V-shape, judicial hanging. So near the angle of mandible, near the angle of mandible. And always remember another thing very important: judicial hanging Judicial hanging is atypical hanging. Judicial hanging is atypical hanging. Complete hanging and incomplete hanging. Incomplete hanging, the body is fully suspended, no part of the body touches the ground, and constriction force is weight of the body constricting force. Due to weight of the whole body, this knot becomes more tighter and tighter, and the the death occurs. Constriction of neck occurs more and more. And incomplete hanging. And in incomplete hanging or partial hanging, the lower body is the touching the ground. Weight of the head acts as the constriction of weight of the head only. Okay, so this is about incomplete hanging. Okay, so we are at the almost as the last part of our FSM, forensic medicine. This is about toxicology. Before starting this toxicology, we will see one of the two important tables, most important tables for toxicology, that starts in the in case of different poisoning, what will be the color of hair and skin. Okay, so in arsenic, yellow color of skin. Yellow color of the skin, hair and mucous membrane. Milk rose raindrop pigmentation. Black foot disease. Black foot disease occurs in arsenic poisoning. Copper jaundice skin. Green blue skin. Green purple line on gums. This is what Bartolinian lines. Bartolinian lines occurs in lead. In lead, blue stipple Bartolinian line. And in copper, it is a purple line on gums occur. On gums. This is also on gums. Blue stipple Bartolinian line occurs in lead. And in copper, green blue skin, hair and perspiration, and green purple line on gums. Okay. So you need to remember these two. So Bartolinian line seen in lead poisoning. Okay, lead poisoning. In mercury poisoning, blue black line on gums. Again in gums, blue black line. So green purple line on gums in case of copper. So on gums, there will be in three cases, like copper, mercury, lead. In copper, in case of copper, green purple. Purple. In mercury, green purple. In mercury, blue black. Blue black. In case of lead, blue stippled. Blue stippled. Bartolinian line on gums, especially on the upper jaw. So very important, this gum lining in the on gums due to poisoning. You need to differentiate this. And brown deposit on anterior lens occurs in mercury. Acrodynia, pink disease occurs in mercury only. So next. So next is this is a substance and its characteristic clinical features. Like in cocaine, there will be Magnus symptom, cocaine bugs, very important. Cocaine bugs or tactile hallucination, black tongue and teeth. In cannabis, run amok, very important this term, run amok, cannabis. Flashback phenomenon, cannabis. In alcohol, McEwen sign, very important, and morbid jealousy. All those points are very, very important. In LSD, bad trips occurs in LSD. Still, questions comes very directly in FMG. Like bad trips occurs in alcohol, cannabis, cocaine, LSD. Flashbacks, okay, flashbacks is okay, LSD and cannabis both. Cocaine bugs, one first important thing. run amok another, McEwen sign another, bad trips. These four things are very, very important. Next, amphetamine, paranoid hallucinatory syndrome, like paranoid schizophrenia. Phencyclidine, dissociative anesthesia. Dissociative anesthesia. Okay, so we will go for some MCQs now. Okay, hypocalcemia is seen in poisoning of ammonia, salicylates, carbolic acid, oxalic acid. And the answer will be oxalic acid. Answer will be oxalic acid. Oxalic acid. Now, those who survives few hours of oxalic acid poisoning, what happens? They get hypocalcemia because it readily combines with the calcium ion. Oxalic acid combines with oxalic acid combines with readily calcium ion in the body. Calcium ions in the body and in the body tissues and causes its withdrawal from them. And so calcium ion gets exhausted. And thus hypocalcemia occurs. Okay. Next, garlic-like smell be detected in cyanide poisoning, carbolic acid poisoning, aluminium phosphide poisoning, and organophosphate poisoning. And the answer will be aluminium phosphide poisoning. Now, garlic-like odor is present at the mouth and nostrils. So, first of all, garlic-like smell, it occurs in mouth and nostrils. Mouth and nostrils are the and in the gastric contents in case of aluminium phosphide poisoning only. So death in copper phosphate. Next, death in copper sulfate for poisoning occurs due to renal failure, cardiac arrest, vascular collapse, convulsion. Death in copper sulfate poisoning. Answer will be renal failure. Renal failure. Death in copper poisoning occurred due to hepatic or renal failure, both. Also hepatic failure. Also remember hepatic failure. Next, metal fume fever can be seen in poisoning by all except metal fume fever, except arsenic. Now, what is metal fume fever? Metal fume fever is caused by inhalation of fumes of zinc. Fumes of zinc, copper, magnesium, nickel, mercury, lead, iron, silver, chromium, cadmium, cobalt, antimony, manganese. Okay, chromium, cadmium, antimony, manganese. So the inhalation of fumes composed of these metals called metal fume fever. Okay. Next, poison resembling viper snake bite is ricin, crotin, abrin, V. The answer will be abrin. The seeds of Abrus precatorius contain an active principle abrin. Abrus precatorius. Abrus precatorius. Precatorius contain an active principle abrin Anabrin is what? A toxalbumin, which is similar to viperin snake venom. Abrus fricatorius. Next, Bartonian line is seen in chronic poisoning of Bartonian line is seen in case of chronic poisoning of, obviously it's lead, as we have already discussed. Lead. So a stippled blue line, right? Stippled blue line. This blue stippled Bartonian line. Blue stippled Bartonian line, sorry. So lead. Blue stipple Bartonian line is seen on the gums in almost 70% of cases. Almost 70% of cases. Okay, and another thing is that it appears due to subepithelial deposit of granules. It occurs due to subepithelial deposits of granules. Subepithelial deposits of granules at the junction with teeth only near dirty or carious teeth within a week of exposure, especially on upper jaw. So exposure time 1 week. So if 1 week, if anybody is exposed 1 week just for 1 week to lead, then there can be subepithelial deposit of granules in the gums, and Bartolinian lines may be visible in case of lead poisoning. So anemia with punctured basophilia is seen in chronic poisoning of anemia with punctured basophilia is seen in chronic poisoning of, again, lead. Again, it is lead. Very important point. There can be anemia associated with polychromasia. It's called polychromasia. Polychromasia, punctured basophilia, reticulocytosis, poikilocytosis, anisocytosis, nucleated RBC, that is sideroblast, and an increase in mononuclear cell. So all these things can occur in lead poisoning. Anemia can occur. Anemia can occur with punctured basophilia, reticulocytosis, poikilocytosis, anisocytosis, nucleated RBC, that is sideroblasts, and increase in mononuclear cell. Okay, next question: in chronic lead poisoning, diagnostic increase in levels of copro. Which one of the following is diagnostic? Coproporphyrin 3. Actually, it will be 3. This will be the answer. Coproporphyrin means you see porphyrinuria occurs. It increases, so porphyrinuria occurs. Porphyrinuria occurs. Porphyrinuria occurs due to coproporphyrin 3, which is valuable screening test for lead poisoning. Okay. So for chronic lead poisoning, which for chronic lead poisoning, which we use screening test. For screening test, we can use this porphyrinuria, level of porphyrinuria due to increased level of coproporphyrin 3. Okay, and in the blood, levels above 0.07 milligram percentage occurs, and urine 0.15 to 0.3 milligram per liter is diagnostic. For diagnostic value. In case of blood, chronic lead poisoning, increase of coproporphyrin 3 leading to porphyrinuria occurs, and in case of porphyrinuria occurs, and in case of blood, if the blood levels is zero point above 0.07 gram percentage, and in case of urine, in case of urine 0.15 to 0.3, 0.15 to 0.3 milligram per liter. This is diagnostic. Okay, for chronic lead poisoning. Okay, a patient with, next question, a patient with history of intake of some unknown poison, presence with digestive disturbance, anorexia, dilate pupil, hallucinations and blackened teeth and tongue. Most likely agent is, the answer will be cocaine. You see the negative side effects of the cocaine addiction. It includes increased body temperature, then irregular or rapid heart rate, high blood pressure, increased risk of heart attacks, strokes, sudden death from cardiac arrest. All these are negative side effects of cocaine addiction. And many habitual abusers develop a transient manic-like condition. Similar to amphetamine psychosis and schizophrenia, whose symptoms include aggression, severe paranoia, tactile hallucinations, that is feeling of insects under the skin, cocaine bugs. Okay, cocaine bugs. So these are some features of cocaine poisoning or cocaine addiction. So digestive disturbance, here they have given digestive disturbance, anorexia, dilated pupil, hallucinations. Obviously this these are all features of cocaine poisoning. Okay, of cocaine poisoning. Okay, next question. Antidote for cyanide poisoning is sodium thiosulfate. Cyanide is directly converted to thiocyanate by the complexing of cyanide with thiosulfate under the influence of enzyme rhodamase. Okay, so antidote for cyanide poisoning is sodium thiosulfate. Just remember as a fact, sodium thiosulfate. Next, gastric lavage is not done in corrosive acid poisoning. Gastric lavage is contraindicated when the patient have a compromised unprotected airway and in patients at risk of gastrointestinal hemorrhage or perforation as in corrosive acid poisoning. So gastric lavage is contraindicated when patient have compromised unprotected airway. Compromised unprotected airway, then we should not go for gastric lavage. And in patients at risk of gastrointestinal hemorrhage or perforation. So corrosive acid poisoning, we will not go. We will don't do gastric lavage. Otherwise, for arsenic poisoning, dhatura poisoning, OP poisoning, we can go for gastric lavage. Okay, next question. A 10-year-old boy consumes stain remover. He presents with coffee-colored vomiting. Coffee-colored vomiting, and restlessness. Okay, coffee-colored vomiting and restlessness. So the answer will be oxalic acid. Oxalic acid. So in the first question we saw that in oxalic acid poisoning there can be hypocalcemia, and in this question we get vomit in oxalic acid poisoning has coffee ground appearance because the oxalic acid badly corrodes the stomach walls. Oxalic acid badly corrodes the stomach walls, and there will be bloody vomiting for the same reason. So about oxalic acid poisoning, you need to remember two things. One is hypocalcemia that we have done in the first MCQ. Another is coffee colored or brown colored actually, or actually blood stained, coffee colored or bloody vomiting. This is number one. So first feature and second feature. Okay, next is drug not given in OP poisoning. Drug that is not given in OP poisoning is physostigmine, because in OP poisoning, what happens in OP poisoning? Number A, oxalic acid. In physostigmine and OP poisoning are in the same direction. That is cholinergic effect. OP poisoning is cholinergic effect. Remember, OP poisoning or organophosphate poisoning, it gives cholinergic effect or cholinergic side effect, we say. Yeah. So physostigmine also gives cholinergic. It will increase the features of organophosphate poisoning. It will increase the features of organophosphate poisoning. So the management that can be the best drug to give in organophosphate poisoning is atropine. It is the anticholinergic, and it is the best one antidote for OP poisoning. Okay, not a feature of organophosphate poisoning is diarrhea, dilated pupil, salivation, bradycardia. So answer is dilated pupil, because pinpoint pupil occurs. Pinpoint pupil occurs in OP poisoning, and the other features like parasympathetic, like meiosis, urination, diarrhea, diaphoresis, lacrimation, excitation, salivation. So always remember, for OP poisoning, what are the features we have? What are the features we have? Number one, meiosis. Then we got urination, diarrhea, then diaphoresis, lacrimation, excitation, salivation. Diaphoresis, lacrimation, and excitation, salivation. Excitation and salivation. Okay, so all fluid excretion increases. You see urination, diarrhea, lacrimation, salivation, all this urination increases. Sorry, all this fluid excretion increases. Okay, so dilated pupil, that is pinpoint meiosis will occur, not dilated. Okay, so next DOC for organophosphate poisoning is PM or pyridine aldoxine methiodide, specific cholinesterase reactivators. This PAM is the answer. Okay. Yeah. Next, pinpoint pupil are seen in all of the following conditions except datura poisoning. Datura poisoning, pupils are widely dilated with loss of accommodation for near vision in datura poisoning. Loss of accommodation occurs and pupils are widely dilated, plus loss of accommodation occurs in datura poisoning. Hairs are preserved in which poisoning? Hairs are preserved with blood, urine, hairs, and fingernails are all used to detect arsenic poisoning. All of the following is the features of datura poisoning except bradycardia. In datura poisoning, there is no bradycardia, otherwise dryness of mouth, delirium, dilated pupil, loss of accommodation, as we discussed just now, loss of accommodation, and loss of accommodation, widely dilation occurs. Dilated pupil, it's written dilated pupil already. So best method for methanol poisoning treatment, ethanol, obviously, ethanol, because ethanol infusion will is competitive inhibitor, right? Ethanol is competitive inhibitor to methanol. Competitive inhibitor. Competitive inhibitor of what? Of which enzyme? Alcohol dehydrogenase. Alcohol dehydrogenase. Alcohol dehydrogenase, and so impairs the metabolism of methanol and ethylene glycol. Otherwise, alcohol dehydrogenase will be used in the metabolism of methanol, and vitamin B12 get exhausted in the process. So ethanol is given to counteract methanol poisoning. If the hemoglobin is saturated with carbon monoxide, hypoxia involved will be hemoglobin is saturated. Hemoglobin is saturated. That day we have done different types of hypoxia. It's anemic, right? Anemic hypoxia. You can also refer to the physiology section for that. Most common feature of alcohol withdrawal. Most common feature of alcohol withdrawal is tremor. Tremor. The essential feature of alcohol withdrawals are coarse tremor of the hand, tongue, and eyelids. Coarse tremor. Coarse tremor. And next question: antidote for copper poisoning. Potassium ferrocyanide. Potassium ferrocyanide is the antidote. Management of copper poisoning includes stomach wash with 1% potassium ferrocyanide. To be precise, stomach wash plus 1% potassium ferrocyanide. Okay, not used for treating acute iron poisoning. Not used for treating acute iron poisoning. Desferoxamine is used. Magnesium hydroxide is used. Hemodialysis is used. So not used is BAL. BAL is not used. BAL is it is used in medical in the treatment of arsenic, mercury, gold, lead, antimony, and other toxic metal poisoning, but not in iron poisoning. In addition, it has been used for the treatment of Wilson's disease in the past. BL. Okay, so BL is the answer. Okay, so forensic science is all about that. And next day we will go for another subject. Okay, thank you very much.